Welcome to the last lesson of the reproduction unit. This lesson is all about nutrition and teratogens, specifically during embryonic and fetal development. So we're going to be looking at the effects of poor nutrition on the development of the baby, and also look at the effects of different teratogens on the developing baby. And then we'll briefly explain the effect of STIs on fertility. So during both embryonic and fetal development, the health of the developing baby is really dependent on the environment inside the womb, where it's floating around inside of the amniotic sac, and all of the different substances that can transfer between mother and child through the placenta. So the health and lifestyle choices of the mother during pregnancy will have lifelong effects on the child. Obviously, poor nutrition is going to affect the development of the baby. Spina bifida is a condition where the spinal cord doesn't develop properly, and that happens specifically when the mother doesn't have enough folic acid in her diet, which is a type of vitamin B. This can happen very early on in the pregnancy. Remember that that process of neurulation, the formation of the spinal cord, happens in those first 4 weeks of pregnancy. So a lot of the time, a woman might not even know that she's pregnant during those first 4 weeks. And so because of that, some doctors recommend that all women of childbearing age take folic acid supplements. And any woman who's planning on getting pregnant should be taking folic acid supplements. Women are recommended that they get 400 micrograms a day for at least a month before they become pregnant, and then keep that up for at least the first 3 months of pregnancy. Usually the amount of folic acid that you get just from your diet is not enough. So you do need to be taking supplements if you're a woman planning on having a child. If you don't get enough folic acid, it can, like I said, cause spina bifida, as well as other neural tube defects like paralysis. It can cause hip abnormalities, cause the bladder or bowel of the baby not to form properly, all that kind of stuff. The Canadian government has mandated that some foods have folic acid added to them because there was a big increase in the rate of these different birth defects. So as a way to try to combat them, the Canadian government tried to make sure that our diet contained more folic acid. And then teratogens are chemicals and microbes that can transfer between mother and baby and cause abnormalities when the baby is exposed to them during pregnancy. Most teratogens cause problems in the early development of an embryo. The nervous system is super sensitive to a bunch of different types of teratogens. And again, that nervous system starts developing very early on in pregnancy. And then not only do teratogens cause birth defects, but they can also lead to miscarriages as well. Teratogens that we're going to be looking at include cigarette smoke, alcohol, certain medications, illegal drug, viruses, environmental contaminants, and radiation. Cigarette smoke is a big one. Cigarette smoke contains carbon monoxide as well as nicotine. The nicotine constricts blood vessels to the baby, which results in less oxygen and nutrients getting to the baby. And then carbon dioxide reduces the availability of oxygen in the blood. And so because of that, the combination of these results in the baby's blood oxygen level dropping and its nutrient content decreasing. Even secondhand smoke can increase the risk of a baby being underweight. Actual cigarette smoke increases the risk of stillbirth, miscarriage, and premature birth. Alcohol is a big one. Women are often told that there is no safe amount of alcohol to consume during pregnancy, and that's true. Because alcohol actually crosses the placenta, it can diffuse directly from the mother's blood into the baby's blood, and it actually builds up in the amniotic fluid, and the baby ends up just kind of soaking in the alcohol. So alcohol increases the risk of miscarriage, stillbirth, premature birth, and bleeding during pregnancy. Because the fetal liver is not fully developed until the very end of pregnancy, the alcohol doesn't get broken down in the baby's system the way it would in an adult. and it causes a lot of damage to the brain and nervous system and can even affect the physical development of the fetus. Alcohol results in the head being smaller than normal, a decreased overall weight. It affects the capacity of that child to learn for the rest of their life. A common issue with this is a lot of behavioral and learning problems as the child is like going through school. It results in memory problems, personality disorders, head and face malformations, difficulty distinguishing right from wrong. I know I've had kids that have had fetal alcohol syndrome, obviously not my own children, but my students. And a big issue aside from the learning challenges is that they have difficulty distinguishing like mine from theirs. They think like everything belongs to everyone, so they tend to steal things a lot. So yeah, women should not drink alcohol at all during pregnancy or when breastfeeding. FASD stands for fetal alcohol spectrum disorder. It's essentially all of the different birth defects that are related to drinking alcohol during pregnancy, and it is the most common birth defect in Canada still. So again, like we said, it can cause that low overall birth weight. The development of the child is slowed throughout their entire childhood and adolescence. They can have deformed organs. Their rib cages don't always form properly. Sometimes they have mobility issues. Missing fingers and toes is a common issue. They tend to have very small upper lips and narrow jaws. Sometimes their shoulders are really narrow. And then again, learning disabilities, difficulty understanding things, difficulty remembering things, lack of coordination, hyperactivity in childhood. All of those are symptoms of FASD. And then there are different medications that the mother might be on for completely valid reasons, but that can also cause birth defects. So some seizure medications can cause birth defects. Some acne treatments. If you've ever heard of Accutane, it's a medication that some teenagers usually are on for acne treatment. And if you're on that, you also have to be on birth control because it causes birth defects. Some anti-thyroid drugs, so people who have thyroid issues, some of their medications, some cancer treatment drugs, all of those types of things the mother has to be aware of. Thalidomide is a really famous example of a medication that caused birth defects. It was a drug that was actually used to treat morning sickness in pregnant women in the 1950s. And it resulted in blocked blood vessels that go to the limb of the developing baby and caused severe limb deformities, as well as some internal malformations as well. In 40% of cases, the baby would actually die within a year, and there are still a lot of adults nowadays that are living with the effects of thalidomide and these severe birth defects that came with that. So now, like any medication that needs to go to market before it can be approved for pregnant women, there's very rigorous testing that it has to go through because of that disaster with thalidomide back in the 50s. Of course, lots of illegal drugs are bad for babies. Cocaine increases the heart rate of both the baby and mother while reducing the oxygen supply. Which causes the baby's development and growth to be slowed down. It can also lead to brain bleeds in the baby, which can be deadly. Viruses can also cause birth defects. The rubella virus is a common one that can cause mental delays in the baby after it's born. Certain STIs like herpes can increase the risk of premature birth. And if the baby is infected, it can result in neurological damage, like brain damage, and death in extreme circumstances. Environmental contaminants like heavy metals, for example, lead, can interfere with the development of the nervous system. That's why like lead paint isn't used anymore. Toys, especially toys that little kids use, are screened for lead contaminants and that sort of thing. Mercury, another heavy metal that can cause a lot of birth defects. Again, used to be more commonly used, is not anymore. And other chemicals like DDT, that's the one that they used to use to spray for mosquitoes. Those can result in miscarriage, low birth weight, decreased immune system function, and developmental delays. And then radiation. Obviously, radiation isn't good for the mother either, but radioactive materials can actually move through the umbilical cord to the baby, or just build up in areas in the mother that are close to the baby, like in the bladder, which will then expose the baby to that radiation. Even radiation levels that are too low to make a full-grown mother sick can have major effects on a developing baby. Especially weeks 2 to 18, the baby is extremely sensitive to any radiation. It can lead to things like stunted growth, physical deformations, and decreased brain function. It also increases the risk of the child developing cancer later in life if they were exposed to radiation in utero. So this chart here just kind of shows when different organ systems and different things are developing in the embryo and fetus. And it's during those times of development that the baby is most sensitive. So as you can see, the nervous system is kind of developing throughout the entire embryo and fetus life. That's because the brain is growing over the course of most of that. The heart and the limbs develop for most of the embryonic life. They're not necessarily the fetal life. And then external genitalia, mouth, teeth, those come a bit later. STIs not only affect the baby's health, but they can also affect the ability to conceive in the first place. So STIs can be either bacteria or viral, and many of them can permanently affect the reproductive systems of both males and females and can lead to sterility, which is the inability to have children. So bacterial infections like chlamydia and gonorrhea can cause infertility and sterility in women by leading to something called pelvic inflammatory disease, which causes scarring of the uterus and makes it very difficult for an embryo to implant into the uterine wall because the scar tissue is really tough and not receptive to that implantation. STIs can also cause inflammation in the seminiferous tubules of males, which is where sperm develops, and so that can interfere with spermatogenesis. HPV is the STI that can cause cervical cancer. It's an incredibly common STI and causes cervical cancer in women, and men that have HPV can then pass it to their female partners. And some STIs can be transmitted to the fetus of an infected woman, causing permanent damage to the child. So essentially, developing embryos and fetuses are very fragile and sensitive. They need a really healthy environment for which to grow, which means limiting exposure to any chemicals or any environmental contaminant that would affect their development.